African communities, sudden death often sparks fear and confusion. Too often, we turn to supernatural explanations, believing that curses, witchcraft, or spirits are responsible. But in most cases, the real cause is something we can understand and even prevent. In today's video, we'll explore the 10 most common health-related causes of sudden death in African adults and what you can do to protect yourself and your loved ones. First and most common cause of sudden death is sudden cardiac arrest. It happens when the heart's electrical system goes haywire, causing the heart to stop beating effectively. Immediate CPR and using an AED can save lives, but prevention begins with regular heart checkups, especially if you have a family history of heart disease. Next up is the well-known heart attack, or myocardial infarction. This happens when a blocked artery stops blood from reaching part of the heart muscle, causing damage or worse, death. High cholesterol, high blood pressure, smoking and diabetes all increase your risk. Making lifestyle changes and getting regular health screenings can make a big difference. Thirdly, a pulmonary embolism, or PE. This occurs when a blood clot, often from the legs, travels to the lungs, blocking blood flow. Long periods of inactivity, like sitting during long flights or after surgery, increase your risk. Keep moving and talk to your doctor if you're at higher risk. A tear in the body's largest artery, the aorta, can lead to an aortic dissection, a life-threatening emergency. High blood pressure is a major risk factor, along with genetic conditions. Controlling your blood pressure through diet and medication can reduce your risk. Another major cause is stroke. A stroke happens when blood flow to the brain is blocked, either by a clot or a burst blood vessel. Risk factors include high blood pressure, smoking, and atrial fibrillation. The good news? Many strokes can be prevented by controlling these risk factors. Is hypertrophic cardiomyopathy, a genetic condition where the heart muscle thickens, making it harder to pump blood effectively. While it's often silent, it can lead to sudden death in younger adults and athletes. Family history is key. If someone in your family has been diagnosed with HCM, get screened. Quite similar to stroke, a cerebral aneurysm, which is a weak spot in a blood vessel in the brain, can rupture, causing a life-threatening bleed. Uncontrolled high blood pressure and smoking increase the risk. Managing these can help reduce the chance of an aneurysm rupture. Acute respiratory distress syndrome, or ARDS. This is a severe lung condition triggered by infections, trauma, or other serious illnesses. It prevents oxygen from reaching the bloodstream, leading to organ failure. While ARDS often happens during severe illness, avoiding serious infections through vaccination and good health practices can lower your risk. A severe asthma attack, or status asthmaticus, is another life-threatening condition. During an attack, the airways narrow so much that breathing becomes almost impossible. Proper asthma management, avoiding triggers, and following your doctor's treatment plan can prevent these attacks. For people with epilepsy, sudden unexpected death in epilepsy or SUDEP can be a devastating reality. It's believed to happen after a seizure affects breathing or heart function. Staying on medication and working with your healthcare provider to control seizures can lower the risk of SUDEP. Sudden death may be unpredictable, but many of its leading causes are preventable. By managing risk factors like high blood pressure, cholesterol, and heart disease, we can take control of our health. Talk to your doctor about your personal risks and take action. The life you save could be your own. Stay informed, stay healthy.